So in summary, increased thirst, frequent urination, excessive hunger, unexplained weight loss, fatigue, blurry vision, slow healing, recurring infections, and dark skin patches are some of the most common subtle symptoms that can surface in the early stages of diabetes. If you notice any of these, see your doctor and get your blood sugar tested. The sooner diabetes is caught, the sooner you can take steps to manage it proactively. Hey everyone, it's important to know that there are several types of diabetes, but the most common ones are Type 1, Type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disease where the body doesn't produce insulin. Type 2 diabetes occurs when the body becomes resistant to insulin or doesn't produce enough of it. Gestational diabetes affects pregnant women who have high blood sugar levels. You'll need to get your blood sugar tested to find out for sure if you have prediabetes or type 1, type 2, or gestational diabetes. Testing is simple, and results are usually available quickly. Now, let's talk about diabetes tests. Section 1. Tests for type 1 diabetes, type 2 diabetes, and prediabetes. One of the most common ways to test for diabetes is by measuring your blood sugar levels. There are a few different methods you can use to do this. Your doctor will have you take one or more of the following blood tests to confirm the diagnosis. 1. The first is a fasting plasma glucose test. This test requires you to fast overnight and then have your blood sugar levels checked in the morning. It gives an indication of how your body manages glucose when you're not eating. A fasting blood sugar level of 99 mg divided by DL or lower is normal. 100 to 125 mg divided by DL indicates you have prediabetes. And 126 mg divided by DL or higher indicates you have diabetes. 2. Another test is the oral glucose tolerance test. This measures your blood sugar before and after you drink a liquid that contains glucose. You'll fast overnight before the test and have your blood drawn to determine your fasting blood sugar level. Then, you'll drink the liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours afterward. At 2 hours, a blood sugar level of 140 mg divided by DL or lower is considered normal. 140 to 199 mg divided by DL indicates you have prediabetes. And 200 mg divided by DL or higher indicates you have diabetes. 3. Hemoglobin A1C test is another commonly used test. The test is done in a doctor's office or a lab using a sample of blood from a finger stick or from your arm. You don't need to do anything special to prepare for your A1C test. However, ask your doctor if other tests will be done at the same time and if you need to prepare for them. An A1C below 5.7% is normal. Between 5.7 and 6.4% indicates you have prediabetes. And 6.5% or higher indicates you have diabetes. 4. Lastly, there's the random blood sugar test. This measures your blood sugar at the time you're tested. You can take this test at any time and don't need to fast first. A blood sugar level of 200 mg divided by DL or higher indicates you have diabetes. If your doctor thinks you have type 1 diabetes, your blood may also test for autoantibodies that are often present in type 1 diabetes, but not in type 2 diabetes. You may have your urine tested for ketones, which also indicate type 1 diabetes instead of type 2 diabetes. Remember, it's important to consult with your healthcare provider to determine which test is best for you based on your specific circumstances. Section 2. Tests for gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy. It can increase the risk of complications for both the mother and the baby. To diagnose gestational diabetes, healthcare providers may recommend certain tests. Glucose challenge test. The glucose challenge test is usually done between weeks 24 and 28 of pregnancy. It involves drinking a sweet liquid containing glucose. After 1 hour, a blood sample is taken to measure blood sugar levels. A normal result is 140 mg divided by DL or lower. If your level is higher than 140 mg divided by DL, you'll need to take a glucose tolerance test. Oral glucose tolerance test. If the GCT result is higher than normal, an oral glucose tolerance test may be recommended. You'll fast overnight before the test and have your blood drawn to determine your fasting blood sugar level. Then, you'll drink the liquid and have your blood sugar level checked 1 hour, 2 hours, and possibly 3 hours afterward. Results can differ depending on the size of the glucose drink and how often your blood sugar is tested. Ask your doctor what your test results mean. Testing for gestational diabetes is important for the health of both the mother and the baby. If diagnosed with gestational diabetes, healthcare providers will work with the patient to manage blood sugar levels through diet, exercise, and possibly medication. Regular monitoring and follow-up appointments are crucial to ensure a healthy pregnancy and delivery. Note, it's always best to consult with a healthcare provider for personalized information and guidance regarding tests for gestational diabetes. Section 3. Early symptom of diabetes. Here are some of the symptoms of type 1 diabetes and type 2 diabetes are: 1. Increased thirst and frequent urination. One of the most common early signs of diabetes is increased thirst and frequent urination. The average person usually has to pee between 6 and 8 times in 24 hours, but people with diabetes may go a lot more. Why? Normally, your body reabsorbs glucose as it passes through your kidneys. When you have diabetes, your body can't properly use glucose for fuel, so your blood sugar levels rise. This causes your kidneys to work overtime to filter out the extra sugar, resulting in more urine production. You may find yourself drinking more liquids to satisfy your thirst and running to the bathroom more often. Pay attention if this lasts for weeks or gets progressively worse over time. 2. Dry mouth and itchy skin. Because your body is using fluids to make pee, there's less moisture for other things. You could get dehydrated, and your mouth may feel dry. Dry skin can make you itchy. 3. Are very hungry. Have you ever found yourself feeling unusually hungry, despite having eaten what seems like a regular meal? Well, it might be more than just a passing craving. This persistent hunger could be your body's way of signaling that something might be off with your blood sugar levels. You see, when you eat, your body converts the food into glucose, a crucial energy source for your cells. But here's the catch: your cells need insulin to absorb this glucose. If your body isn't producing enough insulin, or if your cells are resistant to the insulin produced, the glucose can't enter your cells, leaving you with a hunger that just won't quit. This is a classic scenario in diabetes, where insulin resistance becomes a roadblock in the smooth absorption of glucose. Your body, in response, craves more food, hoping to compensate for the lack of energy. So, if you've been feeling like you're eating your usual amounts but that hunger persists, diabetes might be the underlying cause. 4. Unplanned weight loss. Unexpected weight loss is another possible early sign of diabetes. Even if your appetite has increased, you may still lose weight if your cells aren't getting enough glucose to provide energy. Your body starts breaking down fat and muscle for fuel, causing the numbers on the scale to creep down. Losing 10 to 20 pounds without trying could signify diabetes. Before we move on to the next part, I'd like to encourage you to get involved. If you've been enjoying the content so far, please take a moment to give this video a thumbs up by clicking the like button and subscribe to our channel so you never miss out on our new informative videos. 5. Nausea and vomiting. When your body resorts to burning fat, it makes ketones. These can build up in your blood to dangerous levels, a possibly life-threatening condition called diabetic ketoacidosis. Ketones can make you feel sick to your stomach. 6. Fatigue and weakness. Feeling tired, sluggish, and weak can signal issues with your blood sugar long before diabetes is diagnosed. Your cells rely on glucose for energy, but with insulin resistance, your cells are being starved of glucose. This can leave you fatigued with little energy for your daily activities. If you feel unusually drained, and it's not due to lack of sleep or overexertion, get checked for diabetes. 7. Blurred vision. Blurry vision or difficulty focusing can also crop up in the early stages of diabetes. This happens because high blood sugar levels can cause fluid to be pulled from the lenses of your eyes, temporarily changing their shape. You may experience episodes of blurry vision that come and go. See an eye doctor if this persists, as it could be a diabetes clue. 8. Slow healing cuts, bruises. High blood sugar levels interfere with the body's normal healing process in a few key ways. It restricts blood flow and reduces oxygen supply to wound sites. This delays the formation of new skin cells and collagen fibers that are needed to close and heal wounds. It interferes with the function of white blood cells that fight infection. This makes wounds more prone to getting infected. It reduces production of growth factors that signal the healing process. Without these chemical messengers, healing slows down. Minor cuts that once took days to heal may now take weeks. Pay attention to any unexplained delays in healing. It warrants a trip to the doctor. 9. Yeast infections. Yeast infections of the skin and genitals are more common when you have uncontrolled blood sugar levels. The high sugar feeds yeast and allows it to grow out of control. Women may experience frequent vaginal infections, while men can develop yeast infections under the foreskin. Itchiness and abnormal discharge are the telltale signs. If you suspect a yeast infection that keeps coming back, diabetes may be responsible. 10. Patches of dark skin. Some people with diabetes develop patches of dark, velvety skin in folds and creases of the body, usually in the armpits, on the neck, in the groin, inside the elbows, behind the knees, and on the knuckles. This is called acanthosis nigricans. The high insulin levels in the blood can cause skin cells to multiply rapidly, resulting in darkened patches. These markings are rare in the general population, so their presence can signal diabetes risk. So in summary, increased thirst, frequent urination, excessive hunger, unexplained weight loss, fatigue, blurry vision, slow healing, recurring infections, and dark skin patches are some of the most common subtle symptoms that can surface in the early stages of diabetes. If you notice any of these, see your doctor and get your blood sugar tested. The sooner diabetes is caught, the sooner you can take steps to manage it proactively. Remember, these symptoms alone might not necessarily mean you have diabetes, but they could be an indication that you should see a healthcare professional for further evaluation. And that's a wrap for today's video. We hope you found this information helpful in understanding diabetes tests, and the different types of diabetes and the early symptoms of diabetes. Remember, early detection and management are key to living a healthy life with diabetes. If you have any questions or personal experiences you'd like to share, please leave them in the comments below. Don't forget to check out our other videos on health and wellness, and we'll see you in the next one. Take care and stay healthy.